Hello, Facebook land. Yes, it is John Pinto, your roving realtor, bon vivant. I am not a disembodied voice today. As a matter of fact, we have two bodies in front of the camera today. Me and Dr. Alex de Moraes. Nice Portuguese name. And today we're going to talk about coronavirus, proper prevention protocols. Dr. Alex is going to help us with that. But we have breaking news. Alex just decided to withdraw from the Democratic presidential nomination. Everybody else did today, right?
Yes, I only had one vote.
You only had one vote?
Yeah.
Very good.
It's carried me for 30 years. My wife's been supporting me, but I don't know if I can make it further than that.
We won't talk about anything controversial on who you're going to throw your one delegate to.
I know.
We'll save that for another email. Another video. So, Alex, we've had SARS, we've had swine flu, we've had HIV. My family's from Naples. They had the bubonic plague. Coronavirus. Where do we stand in the historical picture of contagious diseases?
Viruses are they like to mutate. Is the challenge that we face. Their DNA is always changing, and that's one of the problems that we have, for example, with the influenza virus every year and creating vaccines for them, or prevention, or even medications. Just because many of the medicines or vaccines are no longer effective towards a specific strain due to a DNA or genetic mutation in the viruses, and that's what's occurred here. So these viruses have been around for a period of time. They infect either animals or people. It depends on when, usually during the wintertime when we're more communal. They like environments that are moist. They like environments that are a little colder. And what we do in the wintertime is we have a tendency to, number one, have rain, number two, be colder, number three, we all congregate together and like to go to places and share viruses. And that's sort of what's happened here. We've had a mutation of a virus, and it is now having an impact on a number of people. We don't think about it, but the flu virus does the same thing every year. We briefly talked a little bit about this in the past. Mm-hmm. And it mutates, and sometimes we have vaccines that are effective against it, and sometimes we don't. But typically the flu virus comes around December-ish in our area. I've seen it last through April, which is a really long time. But it's the life cycle of a virus. It's part of our planet Earth.
So with the flu, you can get a shot, a vaccine.
Correct.
Coronavirus, nothing yet, right?
Nothing yet. They're working on the pipeline. They're talking about a year, which is a fast track to creating any kind of vaccine. But again, a year from now, they'll look at the DNA structure. They'll make a couple of variants from the DNA and the mutational structures, and determine if we need to use it or not. Who knows? Is this going to be a one and gone, or is this going to be something that recurs? We just don't have that data yet.
Okay, so let's talk about what makes sense. How should people be modifying their behavior? Can you give us a little top 5, top 10?
Yeah, I think right now avoidance is primary. So if you have the ability to avoid large gatherings, if you if you have any form of diminished immune response, if you don't have to go to work and you can telecommute, great. Avoidance is going to be primary. If you had the ability to move somewhere where there was no coronavirus whatsoever, then your chances of getting it would be pretty close to zero. Mm-hmm. So Antarctica or the North Pole, that's a good place to go right now.
Yeah, okay, right. All right,
do you have the right clothing for either one of those spots?
Maybe. Okay, so let's hunker down. Okay, so it starts with breakfast in the morning. So maybe rather than standing in line at a overcrowded Starbucks getting an egg sausage sandwich, maybe you start making breakfast at home.
You can also go to Starbucks. I went to get coffee this morning, and I pre-ordered and went in there and went out. Mm-hmm. And there's ways. The next portion is going to be avoidance. If you have to go to places and you still want to, I'm still supporting the economy by going out and obviously spending and doing things. But the next step would be, hand washing. What we don't think about is how often we touch our face throughout the day. But before I get to that, we'll talk about how any of these illnesses, not necessarily just the coronavirus, are communicable, and I think that's important to understand.
Okay, so one of my pet peeves is I could walk into a public restroom and not touch anything. I hover. It's a skill. I can hover and not touch the floor.
All right.
Okay,
That's
I don't touch
too much information right now.
I don't touch any doorknobs. I don't touch anything. Okay, and when I sneeze into the crook of my arm,
That's a really good one. So sneezing into the crook of your arm, or even sneezing into your shirt.
Oh, okay.
What it does is you're decreasing that aerosolization of particles that can go. Everybody has a different opinion. 4 to 6 to 8 feet.
Yeah, and unfortunately, I think the populace at large has not adopted the chef sneeze and preventative sneezing and coughing.
No, I was down in Walnut Creek yesterday, and there was this young lady, and she's just wiping her nose with both hands and then touching stuff in the store, and I'm thinking to myself, my goodness.
My good, yes.
Yes.
Yes, indeed. So sneezing at the crook of your arm, wash your hands.
Wash your hands, wash underneath your nails. There's that 20-second rule where you should really wash your hands. And then one of the things that I've found extremely helpful is put some Band-Aids on your fingers and see throughout the day how often you touch your face. Because, for example, if your eyes itch, use the back of your hand. That doesn't touch anything. So
right.
If you had the coronavirus and you sneezed into your hand and I shook your hand, but I used the back of my arm to scratch an eye or scratch a nose, I'm not going to self-inoculate if I didn't have the opportunity to wash my hands in between that time frame.
Right.
So we gain this by two ways. Number one, the aerosolization of people's coughs or sneezes. Direct contact, through a spouse or a loved one. You may kiss them, or you may have a grandchild that hugs you, and kids are notorious for putting their fingers in your...
They're little disease carriers.
Little disease carriers. They like to pick their nose and then pick everybody else's nose. So they really do. And that's how I got sick one time in my first year of medicine.
Yes.
But short of that, a lot of it is just self-inoculation. We go to communal places, we touch things, and then we touch our eyes, face, and mouth, and that has a good... the survivability of the virus, we don't know yet. They're doing tests over in China based on the number of people who have it. But we know that the viruses live on all kinds of surfaces for a time frame. And if somebody has been there prior to you, whether it be 15 minutes or an hour or two, and they were spreading the virus amongst a table or something, and you touch that, you can self-inoculate yourself. But it takes a load. It's not just one virus. If you and I were to share one virus, there's a very low probability that we get something. So it has to be something fresh and new, and a fair amount of it to really considerably be contagious.
Okay, so let's talk a little bit about the Bay Area. You got San Francisco, Oakland, more rural areas like Napa, Sonoma, Silicon Valley. You got Caltrain, you got BART. You talked about telecommuting. Let's talk a little bit about protocol in the workplace.
So protocol in the workplace is, the things that we're talking about carries across the board. Get to work, wash your hands, don't touch your face. I think wearing a mask is wise, and it's wise for two reasons. I think people feel safer when you're wearing a mask. If you're sick, you should stay home. I mean, if you're sick, you should just basically stay home and rest, because you don't know whether you have the common cold. We don't know whether you have influenza this time of year, or whether you could have something like the coronavirus or similar. All the symptoms in the beginning are pretty much the same. It's been my sort of practice and experience that most of the time when you get something like influenza or the coronavirus, I don't know about the coronavirus, but influenza, it hits you fast, okay? You feel good one day, the next day you have body aches, joint aches, fever, you may have a sore throat or a cough, but it's really a quick onset. The common cold is sort of a slow onset of symptoms. The coronavirus, we still don't know, but it gets back to that concept of how can you avoid spreading it. So getting to work, washing your hands. If you can wear a mask, wear a mask. If you're going to cough or sneeze, Use the what did you call it?
The crook of your elbow.
But you called it the chef's.
The chef's sneeze.
The chef's sneeze.
Yeah.
Use the chef's sneeze, and then don't touch your eyes and face throughout the day. You know, stay in your cubicle, clean it appropriately. Don't share pens, especially if somebody's chewing on the end of it. And your chances of getting something, whether it be the common cold or this, are diminished significantly.
Now, I think this is a fantastic opportunity for people to adopt things like Zoom and do teleconferencing instead of doing a big in-person meeting. I think that telecommuting is way overdue anyway. You might want to renegotiate with your bosses and see if you can do a Friday and a Monday telecommute and work from home. That'll keep the contagion down.
Yeah. Also shifting work hours too, if that's possible, because there's a lot of people that their productivity or work needs don't necessarily match an 8 to 5.
Mm-hmm.
And conversing with your boss to see if you can work, an evening shift
with fewer people.
With fewer people, yeah.
With fewer people,
you might you might find that you're actually more productive and get more done throughout the day, and the commute's less, and so on and so forth.
Now, I noticed you were very sensitive to small business before in one of your remarks. I've been an online shopper for a long time. I never really enjoyed walking into a supermarket. I do most of my shopping through Instacart and Amazon and Wayfair, et cetera, et cetera, et cetera. Do you want to weigh in on shopping in big malls versus online shopping?
I went to the mall yesterday and shopped, so...
You're okay?
I think I'm going to be... all right. I didn't touch my eyes, but I didn't wear a mask. But, it's just caution, throwing caution to the wind. We didn't gather anywhere where there was a whole bunch of people or big crowds, and it's really the communal crowd. It's a bunch of people in one place that you may not know, and as long as everybody's far away from each other, like the lady I saw yesterday, actually, we were in the mall and she was sneezing into her hands 4 or 5 times, and she had a napkin, but then she handed her mom the keys, and her mom took the keys. So that's an example to where if she had a cold, or it might have just been allergies, right? But if she had a cold or influenza or any of the number of other illnesses that are respiratory, the mom could easily acquire that just from handling the keys and then touching her eyes, face, and mouth, because I guarantee you those keys had a lot of droplets on them.
Right,
a lot.
right. All right, so if you had to make a choice of I'm either going to go to a Rolling Stones concert with 65,000 people at a local coliseum, or I'm going to go hiking in the Santa Cruz Mountains, you might opt for the hike in the Santa Cruz Mountains.
Yeah, even if we didn't have coronavirus, I'd probably go hiking in the mountains right now.
Very good.
I'm not a fan of big crowds. It's just the personal thing. I don't mind going to small venues and agendas. It's just, it's not my thing, typically. But from an illness perspective, across the board, you're much safer doing all those things that you've wanted to do that involved less people.
I don't go to New Orleans for Mardi Gras. I don't go to Siena for Palio.
Yeah.
I don't go to Italy between Memorial Day and Labor Day.
Yep.
I go when it's less impacted. It's just more fun.
It is more fun. And then while we're talking, we can talk about masks too.
Yes.
Okay.
Please.
So viruses are extremely tiny creatures. And 2 things. When you have a mask on, if you're sneezing, it's going to reduce the number of droplets significantly, and the distances that it blows is small. You're going to have some side discharge, some up discharge, and down discharge, but you're not sneezing out into the public and aerosolizing people 4, 5, 6 feet away. Okay, so I think that helps. If you wear a mask and then are able to also sneeze either in your shirt or in the crook of your elbow, then that decreases the spread of anything that you have even more.
Mm-hmm.
The other thing that I found is that the mask, what it really does is it prevents self-inoculation, because we're not touching our nose and mouth as much. The mask creates sort of it's a reminder that you're trying to do something to not maybe get any kind of illness or prevent an illness. So
Yeah.
hence behaviors change. And that applies to across the board with humans. Whenever we accept some form of either planned action or we're going to do something, we have a tendency to comply a lot more with a lot of other things that help us be successful, if that makes sense.
Yeah, yeah.
So if you can wear a mask, it's great.
I usually got gloves on.
Yeah.
With fingers.
I don't know what that does for him, other than
Well, if I have gloves on, to keep my hands off my face, or at least,
see,
you know,
yeah. Put gum on there, see what happens.
put gum on my fingers, see what happens. Excellent idea. Let's talk about at-risk communities, people that need to be hyper-vigilant.
Young children, obviously. Children are interesting in that they many times will be exposed to something and acquire it, and they don't have a lot of outwardly symptoms.
Mm-hmm.
So when you look at grandparents and grandchildren, many times when, let's just talk about influenza, kids can have the flu and have very, very minor symptoms, but when they visit their grandparents or loved ones, they'll spread it because of direct contact. And then elderly or those susceptible to illnesses will most likely develop the flu.
Mm-hmm.
But typically, anybody who's immune compromised,
Diabetics?
I would consider uncontrolled diabetics or
Uncontrolled diabetics.
Yeah, diabetics who have uncontrolled. They're more when your sugars are out of control, you're more susceptible to infections, especially skin infections. So uncontrolled diabetes, if you're on certain medicines, especially the new medicines now for rheumatoid arthritis or psoriatic arthritis or a lot of the immune modulating medicines. If you have any illness like you have any cancer, you're on chemotherapy, or if you find that it's interesting because people who have allergies are more predisposed to getting the common cold.
Mm-hmm.
So I wouldn't put that as a high risk situation, but just you need to be a little bit wary that all these you're more susceptible to infections across the respiratory tract.
So what I'm getting from this is it is somewhat binary. You're either more vulnerable or less vulnerable. That makes a big difference in how, I guess, concerned one should be.
I think it makes it, yes. Number one, it probably makes your vulnerability a little more from catching it.
Yeah.
And then once you catch it, the level of intensity. Because if you look, we believe that there are a number of people out there who get the coronavirus, but really have very, very, they think they've just had the cold or something. Mm-hmm. The colds or the sniffles, and they got better on their own.
Right. Now, is it correct that the mortality rate of the coronavirus, such as it has been analyzed, is about 2%? Is that about right?
About a little less than 1.5%.
And how does that compare to past epidemics, pandemics, whatever you want to call it?
Well, first of all, they feel that number's skewed because what they're doing is they're looking at the number of people who are coronavirus positive in China.
Yeah.
And then the number of deaths from the coronavirus. We're unable to count all of those who've been exposed to the coronavirus and developed mild symptoms and got better on their own, and there was never any reporting. Mm-hmm. So that's the hard part. We don't the amount of time the coronavirus has been around is so small that there's a lot of incomplete information from the statistical point. We think it's the same as influenza, which is about 0.5%.
0.5%. That doesn't sound too terrible. So let's take
unless it's you.
Well, and that's where I'm going right now.
Yeah.
So let's take that 0.5%. If you take that 0.5%, so if you have 200 people with coronavirus, one may die. Correct?
If you have 201, one will.
Yeah. Okay. Now, what percentage of the mortalities will be from vulnerable, at-risk communities like you just mentioned? Elderly, young, sick, immune, rheumatoid arthritis medication, et cetera, et cetera.
I'm going to say it would probably, and this is not a hard statistical figure. This is based on my expertise over time. I'd say it's probably a third, 2/3. So 2/3 are going to be individuals who are more prone to illnesses across the board. So elderly, frail, pre-existing illnesses, diminished immune response. Those are the people who will have worst outcomes. If you have a good immune response, you're still susceptible, but you may get the illness and get better from it and think it was something very minor.
Oh, okay. So,
and that's why that statistics of it's actually 1.4% right now.
Yeah.
Is we don't know how accurate that is.
So it sounds to me that if you are not at one of the at-risk communities, there is no particular reason for fear and panic. Concern, caution, yes.
Concern and cautious, appropriate hand hygiene. If you have a mask, wear it if you have additional concerns.
Mm-hmm.
But, I'll divulge my age. I'm 55. I'm in a medical practice. I have a private practice, and I see sick people all day. And I don't wear a mask in the room, but what we've done is we've made some changes with the coronavirus to where we're getting people, we speak to them on the phone, anybody that's ill, we're keeping them out of the office. So we're trying to be vigilant and trying to contribute to the process of healing, right? So anybody who has a respiratory infection of any form, what we do is we call them. We see if they really need to be seen or if they have minor symptoms. And if they do, then what we do is we arrange for a visit after hours, so we're not exposing the rest of our patients to somebody who may have an upper respiratory infection. From there, what we do is we're determining, is it the common cold? Is it influenza? Is it something worse that we have to now call the CDC and ask them to take a look at this person?
Now that you've divulged your age, I feel compelled to divulge my age. I'm going to be 69 this year. You hope you look this good when you're going to be 69.
I do.
I know a good place.
I'm hoping I get to 69 the way I'm going.
Now, rumor has it that there are certain Cabernet Sauvignons and Cabernet Francs from Mount Vida appellation that actually help increase immunity for the coronavirus.
They do.
Is that true?
They do. There's a certain brand, too, that I found that
I would imagine that's going to be on a future vlog.
I think we should talk about that, yes.
That's right.
Yeah, we started making, I think we breached on this last time we started making wine this year. You have to when you're in Napa, right?
Yeah, right.
So John's excited to try our wines. We were just releasing in April, so it's called Moraes, which is French for big letters.
Oh, yes.
And we're making bold, elegant wines, and so we're excited. So Moraes wine, we actually have wines online now if people are interested, but it's exciting being in the business.
You're going to have some kind of an open house soon, aren't you?
We're having a release on March 21st. It's on our website. And then we're having a release in the fall, because the fall is when we're having our Mount Veeder cab and our Napa cab come out. We started in 2018, so obviously things take a while. And next year we're doing a Sauvignon Blanc, and we're also going to do a barrel reserve, to where we're aging select grapes that we pick. We're aging them longer and trying to make an even more impressive wine.
Oh,
so
great!
It's exciting.
How early in the morning should I start drinking your wine to
Cab
increase
Franc?
my chances of not contracting coronavirus?
I'd say as early as 7:30.
A.M. A.M.
No,
I'm going to have to start late. I usually
drink in moderation. I've always said that across that board. If you look at it, and if you talk about alcohol, right, it's 2 drinks for men, 1 drink for women. I did not make up those rules, so please don't send me bad emails.
No.
But if you look at statistical for immune response, and we didn't talk about alcohol and alcoholism, which is something that everybody should be cautious for. But alcoholism is another one of those is another one of those illnesses that diminishes the immune response across the board. So alcoholics are more susceptible to a number of illnesses. So, but moderation is important in everywhere, obviously.
Well, I didn't mention, behind us is the Great Wall of Rutherford. Richard Dubin has referred to that, my friend Richard Dubin, in the past. And England Look always happens to be a great place to vlog, minus the tornado winds that are running all the time. But just to show Alex, I usually buy these little demis. They're 375s. and
It's nice for two people.
yeah, it's nice. We're not overindulging, and at home, I'm much more of a coffee and tea drinker. Are you a coffee and tea drinker?
I like coffee. I'm really learning to expand on the palate of coffee because coffees are so different across the board.
Yeah, I've got a Breville grind control. It's got a burr grinder with a hopper and a lot of different controls. And then I've got a Breville frother, and I have gone to oat milk because I find that dairy sends my system into a tailspin.
Some people are sensitive.
Yeah, and then I've got a whole tea station on all kinds of artisanal teas, especially Quares, oolongs, black tea, rooibos. Have you ever had rooibos?
I haven't had rooibos.
Yeah, it's off some bark in South Africa. It's supposed to have anti-inflammation properties.
There's a lot of anti-inflammatory stuff, and I think we were talking about. Were we talking about drinks, anti-inflammatory drinks the other day? We were talking about tea.
Tea. Yeah,
tea.
And they got the shrubs too over at the Napa Farmers Market.
Yeah, and if you look at a lot of the foods that are antioxidants, getting your fruits and vegetables during the day, mushrooms are pretty amazing. A cup of two of coffee, whether it be caffeinated or decaffeinated per day, and I think tea falls into that same line of sort of antioxidants. Wine, red wines, of course, a little bit's good, but
how about Lagavulin 16 single malt Scotch? What can I do with that?
I don't know if there's any antioxidant properties to that other than if it makes you happy. The studies show happy, and the people who are happy do better across the board in any illness. I was just having a conversation with somebody the other day.
Yeah, let's go there for just a minute. My requirements for being happy are very minimal. Number one, if I wake up in the morning, I'm pretty happy.
Yeah.
If I actually land with 2 feet on the floor, I'm pretty happy. If I make sure that my coffee maker is properly assembled and I don't create a disaster in the kitchen, I'm happy. And then I'm overjoyed if I have a chance to sit here talking to you, drinking some Cabernet Sauvignon, doing a video blog.
That's kind.
So can you talk about how people affect their own happiness and how their own happiness affects their outlook and their health?
It does. If you look at cancer patient, if you look at the studies related to cancer patients, on average, cancer patients do well when they have a positive or happy disposition towards, number one, that they got cancer, and number two, to their treatments. So I think that speaks a lot to how the happiness plays a part in developing and in keeping your immune system improved. And so I think that applies across the board. People like being around happy people.
Yeah. I think one of the keys to being happy...
You have a lot of friends.
You have a lot of friends, and be active.
I've only heard maybe a few say bad things about you, but that's pretty rare.
Oh, I do have a lot of friends.
And those are your best friends.
I do have a lot of friends. Yes, I do.
So you have a lot of friends because you have a happy disposition. I've never seen you. I was just talking to my wife the other day. Every time I've seen you at our Napa Valley Wine Tasting Society, you're always talking to people and you're having a good time and you're smiling and people gravitate towards happy people, and we know that. So I think your entire disposition throughout the day, if you wake up happy, it changes how people interact with you, and you'll have a better day. And it's easy to do a test. Just go to work one day, say hi to everybody, have a constant smile on your face, and see what your day is like, and then come in the next day and just be chronically upset and angry and call everybody hey you, and then see what happens on day two. And I think they're going to like the first you versus the second you.
Yes. I consider myself very lucky that I hit the mom and dad jackpot. They were both very accepting, very social, very outgoing, didn't have a lot of baggage, prejudiced or otherwise, and so it made my life a lot easier to live.
Yep. I'm
not saddled with that. So anyway, if you want to get together with Dr. Alex, let me know. He is a concierge doctor and is in practice, so if you're looking for a doctor, certainly available. And even if you're not in Napa, as far as I'm concerned, it's great to have a doctor in Napa, because how often do you go see the doctor? And
It's a write-off.
yeah, you know, you could come to Inglenook, which is where we're recording. It's a write-off, and join Inglenook, have a membership, hang out with me over here. You know, right after you go see Dr. Alex in the morning. And as you know, I am a vlogger enthusiast. I love talking interesting people on my vlog, but I make my living helping clients, 4,000 of them, buy, sell, and exchange real estate in the Greater Bay Area. So if you're looking to do any of that, don't hesitate to call me. And Dr. Alex, what parting words of wisdom do you have for our viewers?
I would say, you know, don't panic with the corona stuff. Listen to the news appropriately. It was interesting this morning. They were talking about, you know, the 2 cases that have coronavirus, and then they said presumptive. So be cautious. Make sure we're looking at true data. The CDC's got a great website right now on coronavirus. They're very informational, and they give you tips across the board. And you know, do the things that you can to help prevent illnesses by hand washing. Stay away from big crowded areas if you can. And then if you need to, wear a mask. It'll protect you and it'll protect others.
That sounds pretty basic. Thank you so much. I look forward to our next vlog, and stay tuned for the next one. Bye, everybody.
Thank you, everybody. Stay healthy.
Okay.